Well, welcome to today's update. It's Saturday the 30th of May. Now, I want to do a bit of an update from a few countries this morning. There's some concerning trends in the United States and in the United Kingdom, and a few other countries to look at. But I want to start off today with Canada. Now, Canada are supplying this very useful dashboard here. So we can see the number of new cases is 906 in a 24-hour period, giving a total of 89,418 cases. And it's quite useful if you want to look at the different provinces of Canada here. And of course, I've posted a link to this site so you can look at your own province of interest in more detail. Another 102 new deaths, giving a total of about 7,000 deaths altogether now. Now, this is the new reported cases on a daily basis. Now, this is sort of the peak area here, but it's not really falling off that quickly. This is why I wanted to highlight Canada, really. These cases aren't really dropping off very quickly. They are reducing, but with the measures being taken in Canada, we would certainly hope for more. And likewise, new reported deaths. Now, of course, the deaths are delayed by a couple of weeks, so that's May there. So like these deaths here now towards the end of May will have been cases that contracted the disease in early May. But again, we're not really seeing the drop off that we would like. So a bit concerning there about Canada. Things just seem to be bumbling along rather than going down nicely like they have in some other countries. So ongoing issues there. It's not going away, that's for sure. Now, the other thing that struck me about Canada is there's been a lot of deaths in long-term care facilities, and I'm glad to see that there's a sort of a national review of that now. So hopefully this will be things will start to improve there now. But I know we've seen tragic cases in Canada where the army were actually involved in that in care facilities. So let's hope cases do start dropping in Canada, and what we're seeing is a lag effect. But it's not dropping off as quickly as most people would have hoped. I think that's a fair statement about Canada at the moment. Now, the United States, basically getting on for 2 million confirmed cases now, 1.75 million confirmed cases, well over 100,000 deaths confirmed. Now, bit concerned, well, very concerned really. Atlanta, New York City, Minneapolis, Denver, Houston, quite a few other areas we could mention, with the rioting that's going on at the moment. Now, some places it's demonstrations. I think it's fair to say in Atlanta it's been frank riots, and I think it was the mayor of Atlanta. She was on TV condemning these riots. Now, protest, of course, is a completely free democratic right. Rioting certainly is not. But even in the rioting situation, then certainly social distancing wasn't being observed. People weren't wearing masks. And even in the demonstration situation, which of course is completely legitimate to demonstrate, many protesters, I've put some, it depends on the video you were watching, some protesters not wearing masks, and certainly not observing social distancing. Now, what this means, let's be quite clear about this. This means there's going to be more cases as a result of these demonstrations. It's that simple. There is going to be more. So I would appeal to people to demonstrate within their rights, of course, but do so in a responsible way, because we don't want one tragedy to be compounded by many more tragedies, albeit of a different nature. Now, the links with the World Health Organization have been severed by the United States. I'm not going to comment on that, just report it as a fact. New York City reopening on the 8th of June, getting back to, Andrew Cuomo, I think it is, saying getting back to a new normal. So it's not going back to normal, of course not. It can't do yet, but a new normal. A pragmatic accommodation with this virus. But in San Francisco, the stay-at-home order has been actually extended indefinitely, so remarkably disappointing. And Mississippi, highest single-day increase in cases. So mixed picture in the United States. Hope in New York, but other areas not doing as well. And there will be more cases as a result of this these demonstrations and riots, unfortunately. Now, this was interesting. The CDC have done what you call a phylogenetic analysis. Now, phylogenetic means like the evolutionary study of the change of the virus. So they can tell the particular form of the virus that came in from China, and they can follow that. They can follow that genetically. It's all very clever. It's called phylogenetics. Because of small mutations that occur in the virus. Now, these mutations that occur in the virus that allow it to be tracked don't seem to be making a big difference to the infectivity or the virulence of the virus. They seem to be in parts of the virus that aren't coding for how virulent the virus is. So that's good news. But it is kind of useful because it allows the phylogeneticist to track the course. And doing that, they've worked out that the virus probably arrived in California directly from China. And the current estimate is the 18th of January to the 9th of February. But it is interesting that the more studies we get, the further back this date does seem to be pushed. So I wouldn't be surprised if there's further evidence comes to light that pushes it back even further than this. And the problem is that between these dates, assuming it was these dates, some community transmission was established. It was invisible, no one knew it was there, but it was secretly spreading in the population, or in segments of the population. Then we saw the outbreaks in New York and the outbreaks in Washington State. Now, these pictures we showed that I did show recently last weekend, Memorial Day weekend at Missouri lakes, and I said at the time, what we see here with the complete abandonment of any social distancing and people partying basically in the pools, it will guaranteed spread. Now, the spread is not going to go through the water because the water's chlorinated, but it will go through the air because the people were close together, and it could go from contaminated surfaces. And at least one person so far has tested positive. There may be others to come, and that means health officials have to inform mass numbers of unknown people. So who the heck were those people? Did they all leave their names and addresses? No, I don't think so. So this has made a massive job for health officials who've got other things to be doing, quite honestly, at the moment. This was just crass irresponsibility. If you're at that pool party, consider yourself told off by me now. It's just completely bang out of order. And the amount of work for health officials that you have caused and necessitated when they could be doing other things, it's just out of order. It really is. So if you were at that pool party, you need to self-isolate for 14 days and inform your local health officials to make it easier for these people so they don't have to track you all down. It was too early for a party. It's exactly what we said would happen. Guaranteed spread. It was obvious. Now, the United Kingdom. The cases are way higher, as we'll see. The death figure is accurate. This is deaths from in all places now. So this includes care homes and hospitals. Getting on for 40,000 deaths. Now, there's aims to reduce the lockdown in the UK now. And a few sage scientists, scientific advisory group for emergency scientists, are saying this is going to increase cases. Well, of course it is. Of course it is. I don't think we need clever scientists to tell us this. I mean, I suppose it's good that they're sounding the alarm to raise debate. But we can either stay completely locked down for long periods of time and have less cases, or we can start to reopen gradually. That will increase the R0. We know that's going to happen. But is there a realistic alternative is the question. So it's okay for scientists sitting there saying, well, of course, this will increase cases. Well, of course it will. It's going to increase cases. So it's a political decision, really, as to whether the more we reopen, the more cases there's going to be. The question is, are these cases going to be manageable? Because staying economically locked down indefinitely is just not a possibility. So Obviously, these scientists are saying there's going to be increasing cases. I said that months ago. It's obvious. It's obvious to anyone that that's the case. So I'm a bit annoyed with scientists at the moment. I'm still quite annoyed from that study I did yesterday about the was it yesterday? Yeah, I think we did a study yesterday about dodgy publications. That was a real sort of that was a real blow. That, I mean, you know, the norms of scientific medical publications seem to have been contravened, and it's concerning. It's not the time we need it. And these scientists are saying, well, there's going to be problems there, but suggest a solution. You know, all these clever scientists, and they're just sitting there saying, oh, this is going to be a problem. I know it's going to be a problem. Anyone knows that. You're the scientist. Tell us what to do about it. I'm disappointed with the response of science and the lack of proactivity and the lack of practical solutions that are being offered as we move towards the more targeted test and trace strategy. Some scientists are doing great work. They're developing tests, they're developing vaccines, but a bit disappointed in our epidemiological type people so far, I must say. Right, COVID-19 Symptom Study. So this is a fantastic app. I recommend it to you. There's the link. Put it on your mobile phone. I've got it. I fill it in every day. It says there's 9,000 new 100 cases in England every 24 hours. That's a lot. Still, every day, 9,000, 10,000 new cases basically a day. Even the Office for National Statistics data says it's 8,000 a day. And actually, this is likely to be more accurate. It's 11,300 new cases across the UK as a whole, 17% down on last week. So that's good. So the new cases are going down, but we're still getting a high incidence of new cases. Now, where's this data coming from? Well, it's by combining COVID swab testing data with the COVID Symptom Study app. We're able to estimate the number of new daily confirmed cases within the community. So it's an estimate. This is the King's College London, the Professor Tim Spector group. But it's probably the closest thing we've got to reality at the moment. And what Tim Spector has said, Professor, this new incident rate will be capturing the day-to-day change in the disease, which means we'll be able to tell the active status of the virus within the population. In other words, this is a real-time study. As a result, we will know whether the infection rate is stable, falling, or increasing very quickly. And then we can titrate lockdown measures and testing and tracing accordingly. So I think it's absolutely brilliant. It's the King's College app, the COVID-19 Symptom Tracker. Now, it's available in the UK, the United States, Sweden, a few other countries. It's available quite widely, and there's about 4 million, almost 4 million people using it now. So this is collecting really good data. So I really would encourage people to do that. For example, I'm going to give you one example. Smoking. So the King's College London Zoe Tim Spector collaboration has come up with this 2.4 million study participants over 2 weeks. Brilliant. I mean, 2.4 million people reporting data. That is just spectacular. Now, people reporting studies, it tends to be a few hundred or a few thousand. 2.4 million is just a brilliant number. You get really good stats out of that. But I'm also very, very, very disappointed. What is wrong with the other 63.5 million of you in the UK? Get this app downloaded. It's not tracking you. It's not putting a microchip in your head. It's not recording your affairs or your dalliances or your social life or and it's not doing nothing like that. It's just you report into it. It's not taking geographical data. It's not geolocating. It's just asking me how I feel today. What's wrong with sharing that anonymously with people that are doing brilliant work? So 64 million people in the UK have not downloaded this app. 330 million people in the United States have not downloaded this app. get it downloaded and give the scientists the data that they need, because this group's doing good work, unlike some others that were mentioned. Right, 2.4 million subjects, good numbers. Do apologise about that rant. Try and keep these things cognitive. Now, 11% of that number was smokers. Now, that's less than the UK. In the UK, it's 14.7% of people still smoke. So not enough smokers have downloaded the app. So proportionately, this app has not been downloaded by as many smokers. So if you're a smoker, get this app downloaded, because there should be 14.7%. Smokers, you are underrepresented. Change that. So 14.7% of smokers in the UK, but 11% reported. Now, of this 2.4 million, the 834,000 reported not feeling physically normal during the 2 weeks. So that was the proportion of people that didn't feel quite right in the 2 weeks. Now, this is the interesting bit. Current smokers were 14% more likely to develop the 3 classic symptoms of coronavirus infection: fever, persistent cough, and shortness of breath than non-smokers. So smokers are 14% more likely, and that's based on these big numbers, to develop these COVID-19 symptoms. Now, what does this mean? It means one of two things. It either means that smokers are more likely to be infected with the virus if they're exposed to it. In other words, smokers are more susceptible to the virus. Or it could mean that smokers are infected at the same rate as non-smokers, but are more likely to demonstrate symptomatic disease. They are the two possibilities that I can think of at the moment. So smokers are 14% more likely. So I would say to smokers now, and this is current smokers, just current smokers, people that are smoking now, people that are smoking as they brilliantly give in their data. Thank you to all the smokers that did that. So I would say, do you want to cut your chances of having fever, persistent cough and shortness of breath by 14%? Well, if you do, it's a good time to stop smoking. And sometimes, now I'm not being glib about this. Honestly, I'm not. Quite a few of us have addiction problems, and different people are addicted to different things. And smoking, the nicotine, it is remarkably addictive, and I'm not belating how difficult it is to stop. But I've seen so many smokers stop when they've had a good reason to stop. So they needed a reason. So time and time again, I've known smokers that have stopped after they've been in my care in hospital, for example. That's just the final thing that they needed to stop smoking. Or like you, I've got friends who stopped smoking after they had a bad chest infection. So is this something that can help you stop smoking is the thing. And I know it's difficult, but there is support available. So smokers were also 29% more likely to report more than 5 symptoms associated with COVID. So they also get more symptoms. And 50% more likely to report 10 symptoms. So smokers are getting more symptoms than non-smokers, significantly so, including loss of smell, skipping meals, tiredness, diarrhea, confusion, muscle pains. So smokers more likely to get all of these. Now, why do smokers get more diarrhea? Don't know, but this is what happens, and this is based on large numbers, so this is likely to be epidemiologically accurate data. Smokers are more than twice as likely as non-smokers to end up in hospital with severe symptoms. So smokers have got twice the risk of non-smokers of having to go to hospital should they be infected, if they are to be infected with COVID-19. So of all the people that test positive, smokers are twice as likely to be hospitalised, current smokers. So very good reasons to stop smoking. Now, just a few countries in brief now before we finish today. China, 4 new imported cases. They're being quarantined. The United Nations, sad to see that 2 peacekeeping military have died in Malawi in Africa, so not quite sure what the situation is in Malawi there. The data is limited from quite a few African countries. But we just remember those men from, I think they were both men, Cambodia and El Salvador. Italy, no spikes there, looking good for reopening or progressive reopening on the 3rd of June. And on the 3rd of June, they plan interregional travel by Italians and Europeans. So things are looking reasonably controlled. The direction of travel in Italy is good. Portugal also, gradual lifting of lockdown restrictions over the past 4 weeks. No new spikes, so that's encouraging. And the next thing to open are movie theatres, shopping malls, gymnasiums and kindergartens next. Now, Iraq, I want to do some more work on Iraq shortly. That's on my list, but it's getting concerning. Population's 38 million in Iraq. It's more cases than that. It's more deaths than that. I think we can say that with confidence. And the fact that, but even by the official figures, the country's had the highest single-day spike in cases. So I'm going to try and get some more detailed information on Iraq. It's a very concerning country, as indeed is India. Now, as India continues to ease restrictions, in the 24-hour period, there was another 7,964 up till today, up till Saturday. Another 265 deaths. Now, let's just look at a graph from India. Indian number of coronavirus deaths per day. And let's just hope that's a blip. But we can see that they're going up. No real question about the direction of travel in India, I'm afraid. So, concerning situation. And quite a few of you might have seen the about the monkeys that mobbed. It's not funny. The monkeys that mobbed a healthcare worker and stole some samples. Borrowed some samples, but fortunately they've been returned unopened. So the monkeys won't catch the disease and start spreading it in the monkey population, which would have been a concern. So quite funny, but actually a serious side to it. Monkeys in India, they do pinch anything they can get hold of. They pinch first and think later. But fortunately, they were returned unopened, and hopefully, the monkeys won't. The virus won't get into the monkey population. Brazil, another country I want to do more details on. Bit of a South American epicenter. Another 27,000 cases in a 24-hour period. And of course, these are just the official diagnosed cases. And deaths increasing to 27,000. And again, that was just 24 hours. Increase in 24 hours. So, unfortunately, more cases and deaths to come in Brazil. There's no real question about that, I don't think. Unfortunately. Right, some of my favourite people. You, of course. Grovel. Right, yep. Now, this was sent in by Gary in Rainford. Now, here's the track. Now, the track just used to be these two bits here. The main track going down the middle there, and that bit there. But since social distancing has come, people are walking there and there. So I thought that was a really good example to show that people in Rainford, in the north of England, I think, are obeying social distancing rules when they're out for their exercise. So I thought that was just a good example there. Now, this is Janud, who watches in Morocco. So great to know you're watching down there in North West Africa. This is Jason, who's in Michigan. And he's certainly well protected for public places. And I imagine that's vitamin D. I can't quite see it. But thank you for watching in Michigan, Jason. This is another Jason in Canada. Don't know what part, Jason. Sorry about that. But anyway, please, you're watching in the huge country of Canada. Now, this is Joe and Nada. Probably pronounced wrong. My apologies. From Edmonton in Canada. And this is one of my interests here, hydroponics. So they're growing these plants here in this. So the water comes up here, you see, and it contains the nutrients and it flows down here. And the plants grow in these net pots. Fantastic. So it's a way of growing plants without soil, which is one of my interests. So fascinating on 2 levels. I'm glad to know you're watching in Edmonton. This is John, who's well covered up in Hawaii. Looks like you've just nipped off the construction site there, John. Thanks for the picture. This is Joyce, who watches in Los Angeles. Again, well protected. I assume the screen is in front of Joyce and she's listening on headphones. This is Ketawa, who watches in Thailand, as indeed you can see, and is also taking vitamin D3. It's funny, my students in Cambodia and the nurses and doctors in the hospital I worked at in Phnom Penh, the people in Cambodia are just this very light brown, and I don't know, especially, but the girls especially, the students and the student nurses, they like being light brown. So when they went out in the sun, they always covered themselves up, because of course if they go in the sun they go darker brown. But for some reason, I mean, they look pretty good to me anyway, but you know, for some reason they wanted to be lighter brown rather than darker brown. But of course that means they make less vitamin D. So that's fine, you can do that, but then you would need to supplement vitamin D if you're out of the sun all the time. So even in these sunny places, sometimes people like to be lighter coloured, whereas I have no preference. So, but it's what their preference is. But if that's what people are choosing to do, then vitamin D supplement is well worth considering. So that's Katawa in Thailand that reminded me of that story. This is Karen in New York area, who looks like a horticulturalist. This is Corinna in the Faroe Isles. Okay, way up there in the Faroe Isles. Up past Iceland somewhere, is it? I'm not quite sure. I know it's far north anyway. I think the Faroe Isles are Norwegian. Someone do correct me if I'm wrong. But in the north of the North Sea. Thank you for watching. This is Katie, Kerry, Tony in Ottawa. Good to know people are watching in Ottawa. As a household group, it looks like everyone's taking the vitamin D3 there. Excellent. This is Katie in Maryland, who is a prolific mask maker. Well done, Katie. Excellent. This is Keith, who is in the United States. So good to know that you're watching, Keith, in the US of A. I'm sorry I don't know whereabouts you are, but pleased that you're watching. This is Kenneth, who is in Helsinki, down there in the south of Finland. Good. That's just over 1,000 international units, isn't it? I think it's 25 micrograms as 1,000 units. So thank you, Kenneth, from Helsinki. Kevin in Manchester, in the, well, it's south for me, but most people will call it the north of England. Anyway, you don't get much sun. Well, actually, you do. It's been nothing but sunny for the past few days, but that's unusual. We are enjoying the sun at the moment. Coxie and Antonio are watching in Germany. A lot of people watch me over various meals. That's brilliant. As long as you watch, that's fantastic. And I raise a glass of wine to you as well. Now, I might have your name wrong, Kyle. If I have, I apologise, but I know you're in Michigan. So I'm glad you're watching in Michigan.